So Nicaragua is one of the poorest countries in South America and in the world. So there's a lot of needs in the community for healthcare because it's so poor here. So basically what we're doing is coming to the areas in the country that have the highest need for medical care, and that's based on, the population size, how far away their access is to the closest clinic or hospital. And we're setting up a very basic clinic in what's someone's house, but to us in the US it'd basically be like a shack with a dirt floor. So we have a triage consultation area, a dental clinic, an OB clinic, a pharmacy, and then we also do a charla, which is education for the children. And it's pretty amazing that we're able to do all of that in such a small space, but everyone's really working together and the teamwork has just been phenomenal throughout the week.
This collaboration experience with Global Brigades allows our students to be able to travel securely in a group to another country and be culturally immersed in that country. It also allows them the opportunity to be part of an interdisciplinary medical and public health team that can treat up to 1,500 patients within a week. This is an opportunity that just cannot be reproduced in the classroom. This experience with Global Brigades also allows the opportunity for the development of student leadership. We see very strong leaders being developed both in the pre-brigade phase of the program as well as the leadership opportunities of running the brigade in country.
The trip allowed for the opportunity to connect with my fellow classmates outside of the classroom and also to interact with other students from the Delaware campus who we don't see very often. And it also allowed for the opportunity to learn more from the professors outside of the medical and academic environments, but just to learn life lessons from them and to learn more about who they are, and just to see them practicing was a great educational opportunity.
I love the fact that I can take my students up, roll my sleeves up, and be able to do a public health project side by side with them, as well as them getting to see me treat patients and be able to, talk to them about stuff like that. Also too, it's an amazing bonding experience for the students. Like, we can actually see a noticeable difference with the cohort of students that come back from the Global Brigades experiences. They seem to be bonded in a different way than the rest of the class is. They also seem to, have a new level of confidence going into the clinical year, and we're starting to see where that performance is actually showing.
I think it's really important to just try to empathize with all the patients, and practicing in America, it's gonna mean that there's gonna be a really diverse group of patients that I'm gonna see, people from all different backgrounds and different beliefs.
Overall, it taught me that there's a great need for medical attention and service in underserved communities abroad, and I truly feel called to go to those areas and to serve there. Even though we were only there for a few days and did very small things and compared to their needs, I feel like they were able to teach me so much more than I could ever offer them.
We received several big groups, large groups in Nicaragua, but Arcadia is the largest one. And we appreciate that because that tells us how engaged is Arcadia University with our country. Last year we had this brigade here in a community called Mancotal. The number of patients was very big, and the community was so appreciative because they feel that they're being treated with love and with passion. So it's not, they don't just feel that they're getting medications, but they're feeling that people care about them, that our students care about them.
It's just really amazing to me, the patients, not just the people, but their ability to wait for us. So we're driving 3 hours to the clinic and they're waiting. They've walked, some of them, miles to get there, and they are there smiling and they're friendly and they're just so happy to have us there and to see us and get care. So I think the attitudes of the patients is just really amazing, because in America we want everything instantaneously, and they're just willing to wait, because if we don't help them now, they might not see a doctor for another year.
So the last Public Health Day, we did a second smaller charla where we actually went into the houses of the community members. We just sort of walked up the path and then went in a bunch of houses in a row. And that was really cool to see because in the clinic we saw the patients, but they sort of came to us, so it was out of context. So it was really neat to see them in their homes, in their element. And it made it more real, like what they're going through. And that portion, I think, was my favorite because the medicines we give people might help them for a month or 2 months with their headache, but the education kind of lasts forever, you know? And I think it was important for these people to see that Global Brigades isn't just here every 4 months to, you know, hand out some Advil. Like, you know, we don't forget about you. You know, we're here in between, and we want you to get better, and we want to help you in any way we can.